Welcome, everyone. We're here with Whitney Hebbert, and she's going to be telling us about herself and about Meadowbrook Counseling.
Hi, yeah, thanks for having me. I am a marriage and family therapist, and I've been practicing for about 10 years. Um, I see kids, couples, teens, families. I specifically do a lot of trauma work and EMDR, which helps people work through and resolve trauma. And we also do neurofeedback and ketamine infusions at our clinics. Um, all of those help with trauma. So we have 11 locations in Utah since COVID started. So the past 3 years has just grown a lot.
Okay. And you kind of mentioned already what type of services Meadowbrook Counseling offers. Do those all help with struggling and dysfunctional families before, during, and after civil cases such as divorce, paternity, and child custody?
Yes, absolutely. The divorce can be traumatic for everybody, even if it's a good thing to happen, even if it's probably best for everyone to get the divorce. Sometimes that's the case, but it's still hard and a lot of loss and confusion for the kids. Um, and even if people don't want to be married, it's still not fun for them to hear that their ex-spouse is dating or getting married, So yeah, EMDR, neurofeedback and ketamine, I've seen it help people with going through divorce and the trauma of it or the stress of it. It can help tremendously.
Which leads us kind of in the next question. Which types of therapy are best for the different stages of trauma, grief, and processing divorce and child custody changes? Like, is it good to seek, and what type of counseling to seek before the changes are implemented? What is the best type of counseling to receive when you're going through the changes, and then like post changes?
Um, Honestly, it depends on the individual, but I would say if a situation is kind of volatile, reunification is really good for families so that they can work through things more civilly for the sake of the kids. And then, um, yeah, it depends on the family dynamics and how severely everyone's struggling with things, if that makes sense. Um, I would say for most cases, EMDR will help before, during, and after. It just does. Um, I think neurofeedback is more for people that are so dysregulated they can't really work through things by talking about it. And ketamine helps with like treatment resistant issues like depression, anxiety, that they've tried medications over and over and it's not working. But I've seen it where people are addicted to alcohol or other things and it's really damaging the whole family. And then they do ketamine and they stop having an addiction with that substance and the family can start healing. And then EMDR comes into play and therapy for other family members comes into play.
You briefly mentioned reunification therapy, but for those people who don't know what reunification therapy is, what is reunification therapy and how can it help in divorce and child custody disputes?
Yeah, that's a good question. So, um, reunification, it's you have to be trained to do it for to help families through things like that. But it is for families who are going through divorce and just can't seem to get on the same page or agree with anything that the other person wants. And it just causes a lot of suffering and parental alienation sometimes. And so the therapist can help prevent that. They can help buffer some of the hardship the kids are going through by helping the parents learn how to be supportive through that transition and all the change. Um, but also it helps prevent alienating one parent um, because sometimes kids, even if parents aren't saying negative things to the kids about the other parent, kids pick up on stuff and hear things and they internalize it and it really affects them. So it's just good to have the family work together, even if they are getting divorced. It's best for the kids, usually.
feel like kids are a lot smarter than the courts usually give them credit for sometimes. Kids can pick up on things that are
Yeah.
going on, even if it's not directly said to them.
Oh yeah, kids are so they are like sponges. They hear everything. And even if they don't want to hear it, And and sometimes parents don't realize that the kid most of the conversation and that they're sad and scared and they don't know who to talk to about it.
Or kids can really easily learn how their parents' emotions work, right? And you can just read your parent usually by just like looking at them and you can see how they're feeling in different circumstances. So
Oh
kids are
yeah.
smart.
Yeah, they are. And then sometimes because the parents are going through so much emotionally, financially, right? Like changing jobs or moving, sometimes it's just not addressed enough. There's not enough attention given to the kids and how it's affecting them. Um, if kids have to change schools or don't get to live with certain siblings anymore, like it's really traumatic for them.
So why and how does reunification work?
Um, I, I think again, your unification, it really helps prevent a lot of um, the pain that the family is going through. Just it's still going to hurt, but it helps it helps it not be as awful, and it helps prevent more suffering for kids, and it really helps with parental alienation. But the being having said that, there are some therapists that maybe aren't trained in it, and so they can cause parental alienation accidentally. So it is good to go to someone that is AFCC trained, and that's the courts. You can do that and do a training through them so that you can help your clients the best you can. But people should be aware of that to go to someone that is trained in reunification.
Do you ever have cases or family where unification doesn't help relationships and the relationships grow worse through you trying to have reunification therapy?
I have heard of cases like that, and that's usually if a therapist isn't very well trained, and they don't stay unbiased or objective, and they start to maybe side with one parent over the other, and then that causes child alienation, or sorry, parental alienation, and it's just not good for kids. Um, Having said that, if that is happening, then I would recommend that people stop seeing that therapist and go to someone else. But usually, or if one parent is, really, really unhealthy and lying about everything, that can be really hard, which is one of the big reasons why we offer reunification as for therapists that offer that, because sometimes parents are just so afraid that they're going to lose their kids or they really hate the other parent so much it can get really toxic. Not always, right? But when it is that toxic, it's good to have a third party there to help the kids through it.
Reunification therapy is still successful when the children do not want to be involved or fight against going to therapy and don't want to interact with another parent. How do you work
Um,
through situations like that?
that's yeah, that's a good question. That it is more difficult when kids don't want to go, but that's why like therapy and getting to know the kids and trying to support them individually is important because I think most kids don't want to go to therapy anyway, you know. But then you add in, we're going to talk about this horrible thing that's happening to you. They don't want to talk about it usually, um, or they're afraid to say something to hurt the other parent, to hurt their feelings, or to make them not love them anymore. So, yeah, that can be a challenge. And that's where it's not a quick fix. And sometimes it takes longer than people expect because it takes time to get to know a kid and to build trust with them and safety so that they can work through stuff.
Because sometimes there's parents that threaten kids, like if you say something, then you're not going to get Christmas. There's sad situations like that that can
Yeah.
impact children's desires to want to be active during therapy sessions.
Oh yeah, for sure. That does happen. And it's another good reason for reunification. It's usually when the parents aren't very healthy or skilled and they don't know how to navigate it and better.
So I was also wondering earlier, you talked about neurofeedback therapy. And I was wondering,
Yeah.
you mentioned it a little bit, but what exactly does it do and how can it help in specifically divorce and family custody disputes?
So that's more, it can help the kids regulate better because they get sometimes so traumatized or dysregulated from what's happening, or they don't feel safe because all of a sudden life is totally different. That can help the kids to calm down and not be so like hyper vigilant or um or anxious or depressed. I use that a lot with kids and it's very successful in helping kids um like with emotional or behavioral dysregulation. So it's not always if kids are like necessarily needing it outside of the divorce, but even going through the divorce, it helps kids handle it better.
Overall, is there a piece of advice you have for people beginning therapy who are nervous to share their feelings or don't want a particular parent to know how they really feel about that parent?
Um, yeah, that's hard. It's very common. It's very scary for kids, and I never make people tell me if they don't want to. It's totally up to them because it's their life, it's their relationships, but I let them know that I'm there for them and I will help them work through the hard things. And of course, they're afraid of having love taken away from them, but most it's hard. I want to say all parents, but unfortunately that's not true. But most parents wouldn't do that. They might be hurt by what's being said, but maybe they need to hear that in order to see what they're doing and to improve and be a better parent for them. So I usually talk to kids like that, like your feelings aren't wrong. Even though it's scary to share them, they're not wrong. They're your feelings, and your parents don't know what you're feeling unless you tell them or explain it. Um, Usually that takes some time to build up to that because it is really scary for kids, especially depending on the parent and what's going on. Usually with reunification, it's because parents can't be mature enough to work through things like in a healthy way for the family, right? So you usually are dealing with the harder stuff and parents that are trying to manipulate their kids or destroy the other parent. And that's why reunification is helpful because it is usually really volatile situations.
Another question that came to my mind about reunification therapy. Does it ever help with like when there's a party that has accused the other side of doing different things to the children, but they have no foundation in the claim? Does reunification help that person who accused the other person come clean that it was just an accusation, or is there any does it help in any way with those types of issues where people have been falsely accused of injuring children?
Oh yeah, absolutely. And um, that's why you would want a therapist who's AFCC trained, because a lot of um, that does happen more than people would expect, and it's really unfair to the kids, and it puts them in the middle of it, and they shouldn't be. It's between the parents, and so creating that safety for a child outside of the parents can help them tell you what really happened, right? And they still might feel unsafe, but maybe they weren't abused in the way that the other parent is saying, right? And they're just saying that to really hurt the other parent. Um, in some cases, they really believe that, but it really didn't happen. So yeah, it gets tricky, it gets complicated, but it reunification helps with that a lot because that is, I think, a lot of things that people are dealing with usually.
Do you have any other pieces of advice for us before we close up or things you'd like to make mention about Meadowbrook Counseling?
Yeah, I think something that I've realized with people and working with people for a while, um, even though like getting support during and right after is really good, and I think necessary for kids and parents, but even years after, like kids, their brain keeps developing and they're going to see it from a different point of view. Um, so even if parents got divorced when their kid was a baby, when the kid is 5, they're like, oh, why doesn't my mom and dad live together? Or when they're 10 or 15, like they still need to talk about it and understand it and work through it and not internalize it, that it's about them and they're not deserving of a family or they're not loved, right? So even though they get help right after and during it, sometimes people really do need help years later, um, because kids keep developing and they need to understand it differently and work through it again. And that's where like EMDR, neurofeedback, and ketamine, I've seen it help with all those stages and during, after, and years later.
Thank you so much for your time and sharing your knowledge with us. If someone wanted to get in contact with Meadowbrook Counseling or you, what would be the best way to try to get into contact with you?
Um, we have a website, it's meadowbrookcounseling.com, and we have 5 receptionists that answer the phones and emails and our chat online. And so, yeah, I would say the website and our phone number, it's on the website. Um, that's probably the best.
Thank you so much.
Yeah, yeah, thank you. Thanks for having me.